Hello, and welcome to the LPA Healthcare Analytics webinar. My name is Steve Leet, and I will be taking you through the presentation today, giving you a little bit of an idea of um, the offerings that we have in the healthcare space. And I'd like to take a few moments to thank you for your time to attend this session. We at LPA have been in the healthcare space since about 2009, helping our customers maximize the value of their investments in their EMR by providing them with the ability to analyze their clinical data in new ways. So, what is healthcare analytics? Well, EMRs, along with other healthcare systems, are creating huge volumes of valuable data. But that data is trapped below the surface and is very difficult to get access to. Healthcare analytics allows users to transform the volumes of data that they have into usable information and ultimately into knowledge that can be used to better the healthcare decision-making process. So, what is a typical current state? When we arrive at most of our customer sites, um, there are a collection of separate data stores, whether it's coming out of your EMR, your practice management system, lab data, etc. Each one of them are distinct sources of data. And every one of them has a set of spreadsheets or personal databases that people have created to try and create useful reports out of them. And these reports are all separate, distinct. Basically, you end up in spreadsheet hell, and they're very difficult to consolidate them. But there ultimately is someone who's sitting in a room somewhere that tries to take the data from all of these different reports, all these different formats, Excel, PowerPoint, PDF, whatever the case might be, and try and bring them into one set of consolidated reports that can be used, that can be distributed throughout the organization. Well, the problem that you have here is that not only is that very time consuming, you end up with multiple versions of the truth. There's obviously prone to error, um, and making sure that the business rules have been enforced correctly, business definitions are the same across each of the different reports and spreadsheets, etc., is very time consuming and very difficult. And you end up with a lot of distrust in the data that is being displayed. So, how do you fix it? Well, first of all, we have to define what the desired state is, and then how do we get there? So there's always going to be multiple sources of data. That we'll never get to a single solution that has every single thing that the customer needs. But what we want to be able to do is collect that data as close to the source as possible and bring it into a single data repository, creating that single version of the truth. It is through this data transformation, or the data transformation is the place where we can start defining and enforcing those business rules, making sure that everybody understands and uses the same definition for each term. What we're showing here really is a flow of data, but there's a lot more to it. We help our customers set up data governance programs where they can define the definitions of each of the different measures and metrics and rules and have that published so that the rest of the organization can know and understand it. But once we've done all of that, we've got it into that single data repository. Now what do we want to do with it? Well, since we have one version of the truth, we can now create multiple dashboards, multiple reports, external feeds to other systems, all coming back off of that one version, so that it doesn't matter how you're accessing the data, whether it's through mobile or through your laptop or a set of CSV files that are being pushed to some other system, the data is all the same regardless of where you are. So this is great. How do we get there? Well, we at LPA have been in the BI and data warehousing space for many, many years. And as we've engaged with our different healthcare clients, we noticed that every customer has their own set of nuances. There's their own little ways of doing things. But in the grand scheme of things, there's a lot of overlap, a lot of similarity between all of our clinical customers, right? They all want to be able to access their data quickly, easily, in a simplified, unified manner. and getting that data is really critical. So we took our experience of BI and of clinical, and we've created a framework that's really a starting point for our customers' journey into the healthcare analytics. So what does that look like? Well, starting off, we have the EMR, right? So whether that's NextGen, AllScripts, Epic, whatever, it doesn't really matter. We have a number of pre-built connectors into the different EMR systems that allow us to extract the data quickly and easily. But starting off, this is where all of the clinical data resides. And at that point, this is really where our analytics starts, right? We have a set of automated feeds that pull the data in on a nightly basis out of the EMR and start preparing it and transforming it and putting it into our clinical warehouse. This happens on a nightly basis, and like I said, we have connectors into a number of different EMRs that allow us to really get this up and running in a very short period of time. You know, so once we have it in our warehouse, we are able to, we've run our cleansing routines, we've done um, our mapping and our validation and all those kind of good things. Now we can start preparing it for use for our end users, right? And we use IBM Cognos as the delivery mechanism for us to, for the set of reports that we've created for our end users. Now, as I mentioned, this is really it's the starting point. It is not um, a turnkey solution. It is a framework that allows you to get up and running, get some standard reports quickly and easily, start showing your users the benefits of being able to do some analytics and some, whether it's simple reporting to some of the more complicated reporting, get you up within, you know, a month or so. You have the data available, and you can start extending it to make it your own. So our analytic really is a start to finish solution of ETL, database, and reporting, and that gets you up, gets you running, and allows you to then tweak it going forward and make changes as you go along. So let's take a look at the actual framework itself. There's a number of different components, all of which are based off of the warehouse. And we have a number of towers that come off of that allow you to then, excuse me, have different views of the data that allow you to look at it slightly differently depending on what your focus is, and depending on what type of user you are. But it also allows you to extend as you go forward, all the time coming off of that one single central repository. So let's dive into these into a little bit more detail. If we start off with the clinical warehouse, it is really that single repository where we store patient information, encounter, diagnoses, labs, etc. All of the clinical information that we need to be able to present the data in our reports. It's modeled for efficient reporting and analysis. So we take the transactional data coming out of the EMR, we get the individual labs, the individual encounters, etc., and convert that across into a format that is highly optimized for reporting so that our end users can have the fastest performance that they can possibly get. We also do nightly updates out of the EMR or any other systems that make sense. And this allows you to have a near, data that is as close to real time as possible, but without having to affect production. We really want to make sure that no user sitting in front of a patient ever has a performance issue with the production system. So we are disconnected from the main EMR during the day, so that we do not affect any patient interaction. So that kind of describes the warehouse and its being the central component, and getting this data, defining all of those rules, embedding them in the data itself, really allows us then to go up across the different pillars and have that same set of information being reported regardless of how you want to take a look at it. if we take a look at the clinical reporting side, really these are more tactical type reports. This is more point of care. These are the reports that you want to, when you're sitting in front of your patient, you want to be able to take have a open conversation with them. These are the types of reports that we have. It also allows you to do some discovery of the data. So you start looking for certain patients that have certain conditions or where there's gaps in their care, some exception-based reports. That's what these reports are. Some examples of these are our pre-appointment checklist, which we'll go into during the demo. I'll show you a little bit about how that works. We have a set of immunization reports, and then some basic patient information reports, so contact lists, details, etc. Now, again, because this is all sitting on top of the IBM Cognos delivery tool, that we really have a number of different ways that this data can be presented, and it doesn't really matter which pillar we're on. All of the data can really be exported out to email if you wish, and it's secure. You obviously have to be careful when you start talking about patient information in email. You can send it out to PDF or to Excel or to CSV, etc. So lots of different options when it comes to reporting. Moving across now onto the chronic disease reporting, these are a pre-built set of dashboards and reports that manage patient populations with chronic conditions. So the way that we've set this up is really you identify a population, whether it's diabetes, coronary artery disease, asthma, whatever, any population of patients, some way that we can identify them. And then once we know the population that we want to measure, what are the different activities that you need to do when it comes to managing that particular condition? So in the case of diabetes, what are the different labs that we should be looking at? What are the types of visits they should be having? What are their vitals, etc. So individual metrics or individual activities that can be measured, and we group those then together into summary form so that we can start off at a very high level, allow us to summarize an entire population of patients and look at it from a practice, from a practitioner or provider view, and then down to the individual patient. So it really does allow you to start at a very high level and then drill down. What we also do with our chronic disease reporting, and we'll actually get to this in the demo, is we allow you to create different types of benchmarks, identify programs, so you can actually see how you're tracking in terms of whether it's an internal benchmark, what percentage of your patients have their diabetes controlled? Are you above or below the benchmark? What is the industry standard? Or you implemented a program 6 months ago. Has that been effective? Are you starting to see a change in the outcomes? So it really gives you a lot of visibility into how individual practitioners are doing in terms of managing their care. Again, because our framework is open and extensible, out of the box we ship with 2 different chronic condition categories, being CAD and diabetes, but it's really easy to extend and add in as many different categories as you'd like. We've actually had one customer that extended it and did a well visit or well patient care, so they wanted to actually look at their entire patient population as a whole. So it just kind of gives you an example of how you can extend the application as you see fit. So the next one that we're going to take a look at is some patient-centered medical home reporting. And really, this is a starting point that allows you to start getting visibility into some of the measures and metrics that you have to report on if you are trying to become a patient-centered medical home. It's a set of dashboards and reports that uses some of the existing reports that we use elsewhere. Some of them are new. But really what it allows you to do is start, help you get through that journey of the reporting process that you need to do if you're becoming a PCMH. Again, it's extensible and extendable, so if there's changes or if you want to do things a little bit differently, you have a really good starting point where you can extend it and allow you to make your changes over time and really make it your own. So extensions, you've heard me talk a lot about how we have this open framework. If I haven't mentioned it before, when you work with us, if you should decide to purchase our healthcare framework, you own the source code. This is your set of code to do with as you see fit. Um, like I said, uh, it's not a turnkey solution. It is really that starting point that helps you on the journey of where you want to get to. And it's open. We work with you to extend it, to add additional components. Whether you engage us to help you with that, or after our initial implementation, you feel like you have the skills to do it yourself, that's absolutely fine too. So it really does allow you to tweak what we have, make it your own, and add on additional components. And as we're going through the demo, I'll actually explain some of the things that our different customers have done as they've implemented our framework and how they've chosen to use it and extend it. Um, okay. So, a lot of speaking, hopefully not too much like drinking from a fire hose, but really want to get down to a demo right now and show you the capabilities of what we have, what we have to offer. Uh, Before we start, just a couple of disclaimers. All of the data that you're about to see today is completely fictitious. It's all been made up. Um, what I'd like to show you is some of our framework samples, so some of the sample reports. We'll go through a pre-appointment checklist. We'll do some diabetes analytics, show you some of the extensions, the appointment analysis, etc. And then, most importantly is, we realize that not everything is, no single application will have the ability to answer every single question that you have. We want to be able to show you the ad hoc functionality and really how the Cognos tool together with our data model really allows you a lot of flexibility and gives you the ability to go down any number of paths and answer any number of questions. Okay, so some of the data, to give you an idea of what type of data do we collect. Obviously, there's a lot of demographic information, so sex, gender, sex, age, location, race, ethnicity, etc. We also collect vitals. So, for each encounter, what are the different vitals? The BMI, BP, etc. We track appointments, so we can see who's coming in, when they're coming in, all those kind of good things. Encounters, diagnoses, labs, prescriptions, physicians, etc. So we really do collect a lot of information for each patient um, and store them in the warehouse for easy retrieval. Okay, so with that, I'm going to jump across into our demo. Okay, so here we have the standard logon screen for IBM Cognos. I'm going to log in as my demo user. Oh. Third time's the charm. There we go. So as you can see, integrated security. Make sure that you enter the right password, and you'll get you'll get in. All right, while we wait for that to come up. So this is an example here, really, of our landing page. For those of you that are familiar with IBM Cognos, the content manager, you can really change how you want this all to appear. We have this page here just to make it easy to kind of give you an idea of the depth and breadth of the reports that comes out of the box with our analytic. Really, we have a couple of regions on the dashboard. We have our clinical reports, so those tactical type reports that come down the side over here. We have our PCMH type reporting over here, so that's the second pillar that we have, and then our analytics dashboard, so our diabetes. We don't actually show the CAD, but those are there too. But anyway, so you can see here how we've got really a number of different reports that come out of the box. You hook up the ETL and the data just flows straight in. And what we found really is that when you first go down the path of being able to So when your users are saying, "I need information. I want to be able to ask these types of questions. I need these types of reports." Um, when starting off with a blank slate or a clean whiteboard is very difficult. You start asking, "Well, what do you want?" And it's like, I don't know. What can you give me? What we found is through our implementations of our analytic is that these reports are great food for thought. It's like we put a lot of thought into the kinds of things you should be thinking of. We get you 80 to 90% of the way there, and then make a few tweaks and fine tune the reports, and they become very useful and very usable in a very very short period of time. Uh, you know, Typical warehouse implementations can run 6 months before you start getting any sort of information out or have anything useful or actionable. Ours, we're talking, month time frame type of thing to start getting value add and start being able to use it. So it really is a great uh, starting point or launch pad for your analytics journey. Okay, so again, let me jump into the pre-appointment checklist. So this really here is an example of um, for we discovered that a lot of our customers have daily huddles. So the practitioners are getting together every day. They're talking about who they're seeing, what they should, and all those kind of good things that take place in the daily huddle. And this is a great way as a tickler type of report that says, here's who you're seeing, here's what you should be thinking of. And again, the concepts that are up here, this works great for for your um, standard family practitioner. We have a report for pediatrics that's obviously doesn't care about the diabetic section or women's health. They're more interested in immunization schedules and all the rest of it. So again, same kind of concept, just a different set of measures or columns of information that you want to see on the report. One of our customers, actually, what they wanted to do is said, well, we've got this white space down at the bottom over here. So they decided to fill it that with anybody that's diabetic, they had a diabetic section that had all of the individual components of care for diabetes. So it was, a great form of additional information that was easy to use, easy to consume. Uh, as I mentioned earlier, because we're inside of IBM Cognos, we have the ability to produce this in multiple formats. So this is obviously an HTML browser based. We have the ability to send it out to PDF or to HTML, XML, Excel, etc. Lots of different output formats. One of our customers actually did every morning the report was scheduled to run, and it was printed out. So when you walked in the morning, there was a hard copy waiting for you at the printer. You could pick it up and start taking and start using it from there. So it really gives you a lot, of options for consumption. So let me take you through this report real quick. A lot of color coding. Obviously, like I said, this is all fictitious data, so we're going to have a lot of reds. But one of the things that we discovered, very early on, is there's a lot of rules behind what makes something um, acceptable or not acceptable, and it's not very easy, not always well understood in terms of why things are what makes this color, why is this cell this color, etc. So what we did is for all of our tactical reports, you'll see up here we have the data dictionary, and I'll click on that. And what this does is it runs another report, and it says for every measure, for every column that you're seeing on the report, right, here is, what is the result type? So what are we looking at? Is it date? Is it a yes, no type of thing? When is it required? What does it mean for it to be current or complete? And then for each of the different colors that we display on the report, we really give you sort of what that means. So it's required and received, or it's not required, etc. So you can go through every single measure or every single column on the report and go and see what it means. So for example, here we take a look at cholesterol screening. If you're male and older than 34, you have to have had it with 1 year. If you're female and older than 44, then within a year. If you're hyperlipidemic, etc. You can see how complicated these rules can become. So it's not just a yes, no, red, yellow, green type of thing. There's lots of rules and logic that's built into these to make them meaningful and useful. And we want to be able to make sure that the user who's consuming this can understand that and question it easily, or answer their questions easily, I should say. So let me close that guy out. So if we take a look now and come back to our pre-appointment checklist, you'll notice over here too that for each of our patients, we have the ability to actually dive into additional detail. We can bring up their profile report. So you're not always going to be able to see all of the information that you need to about an individual patient. Obviously, there's not enough room. So we actually came up with a profile report that goes and shows you all the additional information about that patient. So we break it down into, what are the appointments and visits that this patient has had, who are the different providers that this patient has seen, and when is their next appointment, should they have one. If they've been diagnosed with any chronic conditions or risk factors, etc., if they've had hypertension screening, etc., all a whole bunch of additional information for each patient. Again, to give you an idea of some of the extensions that we've had on this, we've had one customer that asked to have all of their immunizations that they'd had in the past. So they wanted a quick visual report on dates and of each immunization. So really, again, lots of capabilities here for you to tweak and customize. But again, great starting point, gives you a lot of information right from the get-go. Okay, so that's really it for the pre-appointment checklist. Again, it's supposed to be that tickler report. Show me, who am I seeing today? What should I be thinking of? Flu vaccine, great example here really is, we're moving to and towards more, a care team. So it's not just the practitioner that's responsible. It's really everybody is responsible for the health of the patient. Flu vaccine is one of those ones that is kind of tricky because, well, not only is the rules behind it complicated, but 9 times out of 10, your patient may have already had a flu shot. It's just not reported. It's not documented in the EMR. So when the nurse is doing blood pressure, BP, on all of the blood pressure, vitals, etc., they could be asking that question: have you had your flu shot? If they had, documented as self-reported in the EMR, so that at least your EMR is up to date. And if not, obviously then see if they want to have it done for that day. So again, lots of ways that this can be used and extended. I'm not going to go through every single report. You can see here how there's a pediatric pre-appointment checklist. That's the one that I was referring to, that actually has the immunization schedules. Who am I seeing from a pediatric perspective? One of our other customers, they're actually in the process of creating they do a lot of obstetrics, so they're actually doing a pregnancy pre-appointment checklist and tracking the data by episode of care, so they can actually go and make sure that all the different activities that need to take place during a pregnancy are being completed. So really, that's a really interesting thing there. Again, we can go through each one of these. Don't really have time to do that, but what I would like to do is here show you our screening reports. So again, these are, like I said, more tactical in nature, but this is now more of an exception-based report. So this is a way for a practitioner or a care coordinator or any sort of administrative person to come in and say, where have we got gaps in our care? Which patients should we really be seeing and we should be calling in? So let me run the report here real quick. While this is running, if you notice over here, we have our patient status. Okay, it flipped past, but really what that allows us to do is you can actually, we have a patient attribution assignment routine that allows us to effectively assign patients to practitioners, and we are able to quantify or qualify that assignment, whether they are currently assigned or it's a sort of a historic or an archived assignment. So we can put in different date ranges that say, have you seen this patient in a certain period of time, then you are a current patient, or you're more of a historic patient, so that these lists here can be better controlled. All right, so the report is up. Here we're looking at our diabetes screening report. So here's the different measures or different activities that we should be looking at for each of our patients. And again, everything here this is an exception-based report. So you'll never see a line that's just green all the way across. That means that that patient is actually doing everything that they should be doing. And probably don't need to interact with them too much, other than to give them a call and say, hey, you're doing a great job. The more red that you see, obviously that's more of a place where you want to be focusing time. You also notice here we have 1,400 patients. Our goal would be to get this number down to some more meaningful number. Okay, so again, lots of color coding in here, so we can go and see where we've got a lot of eye exam and foot exams that are past due. So maybe what we want to do is call all of these patients in and get them in for these visits. We can see our patients who are overweight or obese. Maybe we want to reach out to these guys and say, hey, you know what? Here's an activity program that you guys should be looking at, or set them up with a dietitian or something along those lines. Again, we want to be proactive in terms of helping them manage their condition. So the one thing that you'll notice on this report that you didn't see on the other is my patient contact list. So we want to make sure that all of our reports, all of our everything that you see is actionable. It doesn't help being able to just go and take a look and say, okay, well, here's 1,400 patients. Well, what am I going to do with that? How do I affect change? And the easiest way is to make contact with these patients. So if I run this patient contact list, what this will do is give me all of my contact information for the patients that were on that report. So it's not my full list of patients that have been assigned to this practitioner. It's only those that make up that last report. So there were 1,400 odd patients in there when this report comes back. I'm not sure why it's taking so long, but when it comes back, we'll see that we have the 1,400 patients. It goes to prove that this is a live demo and not a set of screenshots. Interesting. Let's try that again. Oh. There we go, just came up. So here we have our 1,400 patients. There we go, 1,403. And it's got all of our contact information in here for each patient. Again, some of the demographic type information, some of the visit type information that's in there too. And this is really where being able to export it into multiple formats becomes very useful. So I can export this out to Excel and hand it off to someone on the scheduling side and say, please make appointments for all of these people. Or if I wanted to do some sort of mail merge, I can take all of these patients and go and say, okay, let me send them off some pamphlets on how important it is to manage your diabetes, or send them an email, whatever the case might be. But it's, again, this is in order for you to be able to improve patient care, you need to be able to get easily to the list of patients. This is our action, call to action, if you will. Okay. So basically what we've shown you here is a couple of predefined reports that allow you to get access into our patients. But sometimes what you want to be able to do is go actually looking for patients. And this is really our ad hoc light, if you will. It's not a full-blown ad hoc report. It's basically a light version of ad hoc. What this allows you to do is control a certain, the columns that you're going to see on the report, so we can hide and show these different attributes. So for example, over here, if I said I don't want to see any of my immunizations, let me hide those and reprompt. we'll see that there's our immunizations that should go away. Here we go. You'll notice that that they've gone. Now, so that's great. So I can control some of the measures, some of the columns that I'm seeing on the report. But it'll also let me go and look for patients that meet certain criteria. So for example, if I said, okay, let me go and search for all patients that have their LDL greater than 130, have hemoglobin greater than 9, and a BP that's greater than 140/90. So I want to go do a very specific, very targeted search on a group of patients. You can see how that came back pretty quickly, and here's a short list of patients that meet that criteria. So this is a great way for, if I want to do an outreach program, go and say, okay, for example, go show me all my patients who are, meet these specific criteria. Let me get that list, send it out, and then start being able to take action against it. Right. Okay. All right. So the next thing I'd like to show you some of the PCMH reporting. And what I'd really like to show you here is our diabetes dashboard. And this is a great example of how we can take our data that we have and aggregate it along different lines. So what I'm going to do here is actually compare a practitioner against their peers, so that the different practitioners or providers within their group, within the practice, and then compare that provider again against everybody that's in the group as a whole. So again, the way that we've created is provider practice group. If you have different ways that you'd like to aggregate or group your providers, maybe it's provider specialty practice, however you want to do it, we have different ways that you have multiple ways that you can combine and aggregate your data. But ultimately, what we're doing here is we're comparing the provider against their peers and against the total set of practitioners within the group as a whole. And we've broken it down. We have the HbA1c, LDL, eye exam, etc. So we have a set of measures over here. We can go and see that this provider has 195 diabetic patients. The practice as a whole has 563, etc. And we can see how the provider, practice, and group is doing in terms of each one of these metrics. How close are they to reaching their goals? So you can see here the black marker here is actually where they should be. So it gives you kind of a good idea of how close you are to target. That's all very well and good at a high level, but what does that mean? We want to be able to break these down. So what we've done is for each one of these measures over here, we've created different categories. So if we take a look, for example, at our blood pressure, we've broken it down into buckets of less than 120/70, 130/80, 140/90, greater than 140/90, etc. LDL, same sort of thing. So what are the major buckets of data that you want to be able to group your patients in? Doing individual scores, individual values really doesn't help much at this level of analysis. We want to be able to see groups of populations together. So we've defined, as the data comes in, we actually stamp each record and say, okay, this is the bucket, if you will, that you fall in. So it's much easier from an accounting perspective. And you can see over here how the provider is doing in each of the different categories for that particular measure. So from a BP perspective, they have a much larger percentage of their population that it has high blood pressure. And they really, from a patients controlling their blood pressure, this provider is not, has a more of a challenge, if you will, for these particular patients. Now, the other thing that you'll notice here is we have this not current. So we want to be able to show the user what percentage of their patients are past due on any one of these measures. So every measure that we track has an applicable date range. It can be as short as 3 months or 2 days, if you like, and it can be as long as 10 years. In the example of colonoscopy, colorectal screening, for example, have you had a colonoscopy in the last 10 years? It doesn't really matter what the date range is, but the concept is every measure, everything that you track needs to have a valid date range. And all of your patients that are part of the population that you're tracking should be as up to date as possible. And ideally you want to get this not current down to a very low percentage. The chances of it ever being zero, I guess, is it would be very difficult, but we want to track this and make sure that we can get this as low as possible. So even though this particular practitioner is not doing as well or has more challenges with their patients managing their blood pressure, a greater percentage of their patients actually have their blood pressure being monitored on a regular basis compared to the practice and the group as a whole. Um, so you can read a lot of information into this, and I'm going to zoom out real quick just to give you an example. We've tracked all 6 of these, so we have the eye exam, microalbumin, etc. All of them are on here and visible for the user to see. Okay. So let's jump into the dashboard. So really, if you take a look at everything that we've discussed thus far, it's been very much point of care type of thing, very tactical in nature. We started getting a little bit into the analytics with the ad hoc light for the diabetes patient list and the diabetes dashboard. But really, the next step that I'd like to show you here is our chronic disease analytics, and we're going to dive into our diabetes dashboard. And this set of reports, or this set of dashboards, really allows you to start at that 50,000 foot view, look at my patient population as a whole, be able to compare practices or groups of practitioners against each other. Everything that we have, all of this data is based off of individual patient information. So at any point for any month for any practitioner or provider, we can get down to the individual patients that are making up these numbers. So we really store a huge amount of detail behind these numbers that allow you to look at it in many, many different ways, regardless of how regardless of how it presents today. You may want to come up with a different way of looking at it. The data is there. It really just becomes what's the easiest way to present it, or what makes the most amount of sense. So let me take a couple of seconds here. So what we're looking at is for the patients that are diabetic, because we're looking at a diabetic dashboard, we track 16 different metrics for diabetic care. Each of those metrics are then grouped together into what we call these categories of care. So in-office procedures, labs, vitals, immunizations, etc. So these individual metrics are grouped into categories, and those categories are then presented up here, so we can actually produce a single score for every single patient. These scores allow us to aggregate the data up, not only along the individual metrics, but up the patient, up to providers into practices and groups, etc. So we can have that high-level view that we can then start drilling down into. So I'm going to take, for example, over here, let's take a look at our, excuse me, our in-office procedures. We'll drill into in-office procedures. Okay, so here we have the the office visits report. So we took it really from the overall score, and now we're breaking it down into the individual metrics that make it up. And we can see that we've got eye exams, foot exams, diabetes care visits, etc. And the one thing I'd like to really point out over here is you'll notice that we have, for each of our charts, we have a benchmark that we'd like to achieve. So we allow you to actually go and define as many as you'd like. You can, if you know what the national average is, you can go and put that in. You can also define programs. And I'm just going to change our time frame over here to the last 18 months and hit finish. And what the programs actually allow you to do is start taking a look across time. I've implemented some change. Back in December, we put in this new program. It was called the Diabetes Program. And how's that affected our care? Has it been, has it worked well? Did we roll it out too quickly? Whatever the case might be. So if we focus in here on the eye exams, we can actually see that, we had this downward trend for back in December. We implemented this program. Obviously, the trend is going to continue down for a little bit, and then it started improving. And within 6 to 7 months, everybody had actually met and exceeded the the target. So they were doing really well and continued, but now we're starting to slip back down again into falling back into our old habits. So maybe we need to reinstitute that program. But it really does help you close that communication gap or the communication feedback uh, cycle and give you that view on has it worked. We've had one customer that really used this. They did a rollout into on a pilot program to a small set of physicians and said, "Does this work?" They tweaked it a little bit, and then eventually, once they've worked out the magic formula, we're actually able to roll it out to the group as a whole. A couple of other things to take a look at here. Obviously, we're looking at the practice level. We have the ability to dive deeper down and go and see the individual practitioners that are making it up. Okay, so here we can see how the individual practitioners are doing in terms of managing their patients. Now, that's great. Again, I can see from a whole how we're doing, or what's the trend look like. How do I affect change? Looking at a line chart, looking at a bar chart really doesn't give me, it gives me an idea of where I need to be, but how do I affect change? And there's only really two ways that we can improve patient care. One is either through modifying practitioners' behavior, which could be incentive programs, making sure that the EMR is being documented correctly or used correctly, um, but really not a huge amount that you can do there. Or on the patient side, how do we get to our list of patients so that we can start effecting change? How do we reach out to these patients and say, hey, you know what, you need to come in for these visits, whatever the case might be. So we'll take a look over here, and you may have noticed this on our previous reports, that we have our patient list report that for any practitioner, we can actually dive in and get the list of patients that make it out. The other thing that we can do is we can flip this rather than looking at it from a day-to-day perspective, from a time series perspective, we could actually change this into the current month and go and view the data for the current month. We can view it by demographics. So if we wanted to see a split rather than by practitioners, we could actually see the split by different demographic groups. So lots of different ways that we can actually view and manipulate this data. The whole purpose here really is behind each of these metrics is to be able to start at that high level and then slowly drill down, peel back the layers of the onion to get where you want it to be. Okay, so in the interest of time, I know I could spend a lot of time on each one of these. What I'd actually like to do now is jump real quick into some of the ad hoc analysis. Okay, so over here we have our ad hoc analysis tool. This is the IBM Cognos Workspace Advanced. And you'll notice on the left-hand side we have our canvas where we can start dragging and dropping, and on the right-hand side we have all of our different subject areas of information that we can bring. And I'm going to go through this really quickly. I'm kind of running out of time, but I want to make sure we can touch on all of this. So I'm going to come in and take a look at my lab results, and I want to say how many patients are part of their HbA1c. So I'm going to drag and drop and put that in, and then I'm going to break this out by status. So here's my HbA1c status. Right, so you can see a drag and drop, actually very easy. I don't have to worry too much about how the numbers fall in. It's all taken care of it for me. I'm going to filter this. We've got some predefined filters. So we're going to take it for the last 12 months. I'm going to drag and drop and put that on there. You can see now it's filtered by the last 12 months. I'm going to come take time and my month. I'm going to throw my month on there. And we can see how we've got the breakdown by month. I'm going to convert this across into a pivot table, onto a cross tab, because I want to see my months going across, so each of my different statuses by each month. And now finally, I want to be able to create a line chart and show it side by side. So you can see, and really in less than a couple of minutes, we were able to go from a blank canvas and create a report that had the breakout of the number of patients for each of the HbA1c by status, and we can see how we're trending over time. So we can make this just a little bit larger so it's easier to read. Very simple, very easy. Again, it all comes back down to those business rules being defined upstream in the database, so that I don't have to, as a user, don't have to worry about trying to figure out what the different ranges are, what the different statuses are, who falls part of my denominator, etc. It's all automatically there for me. Very easy, very simple to use. Okay, so that really wraps up the demo portion. Jump back to our presentation real quick. So at the end of the day, if we take a look at what our framework offers and our analytic offers, if you take a look at doing the project by yourself, you can do this. I mean, there's no rocket science in here. It's knowing and understanding your data and being able to extract it and applying all of the rules. And absolutely, you could do the project on your own. What LPA offers is that jumpstart that says, you know what, if you work with us, we've thought a lot about this. We've got the experience. We've had interactions with a number of other different clinical and healthcare providers and understand what they were looking for. We can bring that to you. So we get you up on that capability curve much faster than you can do it by yourself. And we will keep you ahead by virtue of the fact that we have industry experience and we have a broad range of both BI, DW, business intelligence, data warehousing, healthcare, etc. And bringing that all together, we can help you maximize your investment. Okay, and the gap really between the two is the value that we will bring to the table. So let's just do a quick recap. We have, from a solution perspective, we have a number of connections to different EMRs that we can extract the data. We have a set of pre-built dashboards, reports, and ad hoc analysis that can be customized to meet your needs. And this is critical. The framework is up and running in your environment in a short period of time. We've all been on projects that, like I said, it's 6 to 8 months before you get to see anything, before your users have anything. This is a very short period of time. We're talking a month or so before, from project initiation to having reports in the hands of your users. And it can be expanded to include data from other sources, not just the EMR. So one of the great things about this solution as a whole is, while it starts off in clinical, you can bring in data from anywhere, not just EMR. You can bring your financials, etc. IBM Cognos provides that state-of-the-art analysis and reporting application, the ability to export it out to multiple different sources. And again, you have the data. You can build these reports quickly and easily yourself. And the one thing I'd like to leave you with here is that you own the solution, right? You own the source code. You can modify it and extend it to meet your own needs and grow. It can grow with you as your experience and requirements change over time.
So how can we help you? So if you are beginning to go down the path, down the business analytics path, we can come in and help with on-site presentations that are customized to meet your organization needs, whether it's talking about individual, point of care metrics or ACO, or you're looking at doing some more analytics or future-looking things like readmission rates and all that kind of good stuff. We can help you down there. We can help you on the roadmap and whiteboarding sessions. So where are you today? Where are some of your struggles? Where do you want to be tomorrow? Help you figure that out and recommend what the path forward should be. And we can do demonstrations in healthcare. So whether it's a clinical framework that you've seen today, the revenue cycle management, so more on the financial side, or even if you're looking at predictive analytics, we can do some of that too. And at the end of the day, we offer that complete end-to-end solution development for all of your analytic needs, from requirements gathering, technical design, solution construction, training, really, or anywhere in between. Pick and choose. We can be your partner on a very specific tactical goal, or more from a solution perspective, strategic partner that will help you all the way through. All right. Thank you very much for your time today. I really do appreciate it, and hope you found this informative and useful. All right. Thanks very much.